Hello. Welcome to our sort of very first Google Hangout. We did test it this morning and for some reason it didn't work. So we spent some quality time together. But again, epidural and how to make the most of that, or from the midwife's point of view, what's good about it? What is it? That's the first question. What is an epidural?
So the epidural is a local anesthetic that works for women during labor. You could say it's similar to having your teeth repaired. The local anesthetic that is used for that. It's basically a needle that is inserted into the back, and a plastic tube is thread through the needle. Left in the back in the correct space, and what is then done is that regularly or in a continuous drip, local anesthetic drugs are inserted into that tube, and that way they maintain a blocking effect or numbing effect in the area that this is applied to. The most successful way, it basically takes the pain away from the area from the top of the abdomen all the way down to the middle to the lowest part of the pelvic.
So it's not a needle in your back the whole time. It's that plastic thingy.
Yeah, it's similar to an IV line, and that can be inserted into the vein in the arm. This is a hand. This is a plastic tube left in there. So the needle is only put there to insert the tube, and it's taken away. It can be slightly uncomfortable while this is being done, but normally local anesthetic in the skin is used so that the procedure itself is not too uncomfortable.
Okay, let me keep the article in front of us, because Hilda did write an article about the epidural, and we posted it on our blog, and it's also available on our Facebook. So, okay, why would you? Why would you choose to have an epidural? Is there a choice, or?
In most parts of the world, in the developed world, you can choose to have epidural during labor. It requires an anesthetist who is a doctor who does this procedure, and in most private hospitals it's easy to get. There is anesthetists on call, available, and very willing to give it. Most obstetricians in private practice, they prefer epidural use, and there's a view that all women should be offered and be made available very easily for all women during labor. In public hospitals, it's normally not the view that it should be promoted or easily offered, but generally that it's a normal and should be available option for those women that need it.
Medical reasons then?
Not necessarily only medical reason. They may wish to have it without any special medical reason there, but there are certain indications that be, I guess, more medical reasons that will make it more recommended options. These would be, for example, if you're being induced during labor, if you have a history of something specific in your last birth that makes this a more, I guess, more sensible option now. If you have headache, if you have preeclampsia or very high blood pressure, it may help to lower that. Or if you're a high-risk birth, like for example, or higher risk, like with twins, and where there's perhaps more likelihood that you may need some kind of more interventions. There's in most government hospitals around the world, you can have epidural also on request, and for first-time mothers, I think for many this is it's good to know that it's there. Most hospitals, they try and keep the statistics, or try and keep the incidence of giving this during labor somewhere less than 30-40%. So they're not promoting or trying to push it. And of those, more often than not, it's first-time mothers that are the ones that take it. It could easily be argued for second, third time, fourth time around mothers that the epidural perhaps should be made slightly less available, and it is less available. simply because there is sometimes not enough time to give it.
Okay, and let's talk about time. At what stages of the labor would be optimal to get the epidural? Is it difficult to tell?
Let me say first, the women that end up having the epidural, they may be women who, first of all, had always decided that that's what they wanted to do. So this was the plan, they followed it, it came through just the way they wanted.
Mm-hmm.
There is also women who did not intend to have it at all, and the plan was totally different. But somewhere in the middle, it came about to be the choice. And then there are women who didn't never want it, and then end up that way and never used the epidural. And for those women who intend to have the epidural, that was always the plan, and they wish not to have to go through much of labor without it, they are best to get it somewhere when they're in active labor, but not too early. Those that are in that kind of wait and see group, or the women that perhaps rather would not have it, but for some reason end up taking it. Mm-hmm. I guess for them it's either when and if they have to be induced, it's reasonably soon, or after the induction starts, or once the same thing as they've started the sort of the 3 to 4 centimeters into dilation. Most people who are second, third, fourth time around, if they want to have it and ask for it in active labor, they are likely to not have enough time to get the full effect of the epidural.
Okay. Does it change anything if you get it? I mean, does it slow things down or speed things up? Or?
Yeah. Yes. It's so for most people, especially if you give it quite early, it will slow things down a little bit. It's mm-hmm. not necessarily if you calculate the length of labors of those women who have it compared to those that don't. It's maybe about an hour to 2 hours difference all in all. However, most of those women who have epidural, and the earlier they get it, they will end up having to have some kind of augmentation, or as if they were being induced but augmented instead. So in the end, the total time doesn't necessarily end up being longer, but the risk of intervention such as this, increasing the contractions with drugs, and being more tied to monitors and less mobile, vacuum forceps, those kind of things, the risk of this is higher. So yes, it changes that. But it also changes, on the positive note, it makes the labor less painful, for sure.
Yeah.
And
Okay, if we, so that the mobility is something you mentioned as one of the disadvantages.
Yeah.
What is the risk, or can the consequences be, or what's it called, the side effects, or or does it affect the baby, or what happens?
Normally it does not affect the baby. That can be argued. There are different people will argue otherwise, but in most medical research it doesn't seem to show much effect on the baby, except for it may possibly, if it's there for a very, very long time and lots of intravenous fluids are given simultaneously, it may well have the effect that the baby develops a little bit more water, or gets more water and therefore loses more water after it's born, so the weight loss is greater. We can say that may be a direct effect on the baby. It's not been 100% proved. And then there are other drugs that are used in the labor, in the epidural, that may possibly make the baby a little bit drowsy, much less so than pethidine. And typically this is not necessarily one of the things that women will be stopped in their decision to have an epidural because of those. They're more I guess indirect effects on the baby, which have to do with what I just mentioned, the immobility, the cascade of events.
So the birth itself, really.
Having to be induced, having to be monitored, more risk with the induction or augmentation, more risk of both hyperstimulation, but also that the baby gets stressed. more risk of delayed pushing states, more risk of vacuum forceps delivery, therefore jaundice and possibly delayed breastfeeding.
So you don't know of any researchers saying that babies who've been born under an epidural, that they are more sick, or that there are any long-term effects strictly and only because of this?
It may be
not the vacuum or anything else, just that drug.
No, I would say I have not read convincing research in that. However, it's not been my expertise to really investigate this. But no, so far I would say no, I have not seen anything totally convincing.
Yeah.
Overall, when you're trying to decide whether to have the epidural or not, you have to weigh the risk or the pros and the cons.
Yeah.
And if you are just choosing it because you're slightly afraid of what it might become or how long the labor might be, or someone says to you, well, it's only going to get worse, but you're coping otherwise fine, then I would say ask yourself twice, because there are consequences. There are definitely negative side effects of having it. It does make you immobile. You will probably have a catheter. You will likely not move around much. You won't be doing the bath, or usually not the birth ball, or other things that may augment the labor and make it a little bit faster and more, help the pelvis to rotate, help the baby to rotate, help the two to work together to have an easier birth. You're more attached to the bed for sure, and you're much more likely to have vacuum forceps delivery if it's your first baby. And therefore you're likely to have a episiotomy, slower recovery, jaundice of the baby, and slower breastfeeding. There is no doubt about this. However, if you're induced, if it's a particularly long labor, you've been going for a long time, there's been no progress, and you're headed into that area where your risk of C-section starts to be higher, then I would say sometimes the epidural can be the most fantastic option.
Mm-hmm. So it's about making sure that you know what it is, and what you're saying, not just take it as standard.
No, and it's not what your friend says to you, oh, you should definitely take it, it's fantastic.
Yeah.
It's not necessarily the right answer for you.
So you're saying that if you don't get it, so the pros of not taking it is that you'll recover faster, like you said. Breastfeeding will be, will start earlier, or
no, not that it will. That the risks of it is much lower if you don't have the epidural. The likelihood of a full recovery and the cascade effects, the one thing leading to another, is much more likely to be just then free of other problems.
Yeah, of course.
It's not saying there's lots of people, hundreds and thousands of people that have epidural. There's no consequences at all. They're fine. They have perfect births, and they are the ones that come to you and they say you should definitely have it. It's fantastic. It was fast.
Because it worked for them.
Yeah, I didn't need anything. I could be mobile. My baby came out needing vacuum forceps. It was fine straight away. Fantastic choice. But that was that case.
But what would you say? Are you 50% more likely to end up with other interventions if you opt for an epidural? I know I'm trying to put you in the corner here, but let's say,
you're 100% more likely to have something else happen to you.
100%.
Something else will happen to you. Is it bad? Maybe, maybe not. You are going to be attached to an IV needle, a blood pressure cuff, a monitor in 2 places on your tummy, quite likely a catheter. How are you going to move? Okay. So that will definitely happen, 100%. So you're going to have to be very, very resourceful. How are you going to move in that bed to facilitate the birth in an easier way, to lessen your chances of having to have vacuum forceps? And you most definitely need a doctor and a midwife that is not standing by your side saying you can't do this, you can't do that. So if you take statistics alone, it's impossible. So your case and mine is just different cases on a different day. Okay,
but so what you're saying, that being mobile is absolutely essential. There I hear you. You're saying being mobile during labor is essential to sort of get the baby out. And restricting that, in any case,
Yeah.
will make that process less natural. Or
Yes, now putting me into the corner. Don't get me wrong, I'm all for natural birth. And next week we'll talk about natural birth. And then you'll see a totally different kind of angle on this topic.
Yeah.
For some women, being mobile does not matter at all. Mm-hmm. They can lie totally still on the bed, they don't move, they don't do anything, their babies come up no matter what they do. Mm-hmm. That's the wonders of this body. The uterus squeezes out the baby like the colon squeezes out its contents. At some point it doesn't belong in there, in a very positive way, of course. It should come out, the body squeezes it out, and as long as you don't close it in there and it's not something sort of wrong with everything, it will come out.
Yeah.
And that's for some people. Most of us actually have to do some hard work, and the more mobility that you offer, in particular if you don't have full feeling how to push, there's something numbing it. The more mobility you have, more gravity you have, the more likely it will be easy.
Okay.
Yeah.
I have to say, I think this was quite informative. You think so?
Yes.
But it also, this is our first proper talk with a topic. We did an intro, but this is a real topic, and we don't want to keep it too long. I think we've sort of covered most of it, so we checked the article just to make sure. No, I think we've sort of covered the most important questions. Please leave comments if you have any questions, and this talk will be available for a long time on YouTube, so stay tuned, because we're gonna do, like Hulda said, natural birth then next week. And in the meantime, we might add something else. Please recommend further talks if there's something you want to hear about. And for now, I think we'll just say thank you for listening. Stay tuned. Bye.